Yep, charging. Alright, you and your partners are working in a large urban EMS system and have been dispatched to a motor vehicle collision. It is a fall day at 10 o'clock and the outside temperature is 65 degrees. You are 5 minutes away from a level 3 trauma center and 15 minutes away from a level 1 trauma center.
Okay. Perfect. Any other dispatch information?
Nope.
Just, okay.
When you arrive, I'll give you more details.
Okay, sounds good. So BSI, my scene is now safe, correct?
Yep. Fire and police responders are on scene when you arrive. One of the police officers tells you that your patient is the driver of the first vehicle that struck the side of a second vehicle that ran a stop sign. There was an automotive fire following impact and the other driver is deceased. Fire personnel have extinguished the fire and extricated your patient while police have kept the scene safe.
Okay, so patient is now out of the vehicle. Okay.
And right there.
Cool, awesome. So I have one patient, mechanism of injury is a motor vehicle accident. Sounds like they hit someone head on. And so I am going to consider C-spine immobilization, and I don't expect that I'm going to need additional resources. So looking at my patient, is he laying on the ground?
She is laying on the ground.
She is laying on the ground. Is
Yep.
she conscious?
She's looking at you.
Conscious and looking at me laying on the ground?
Yep.
Okay, alright. Hey, can you tell me your name?
Yeah, it's Betty.
Betty, can you tell me what happened?
Yeah, I was driving and a car ran around the stop sign and I broadsided it. And then my car caught on fire.
Okay, so it sounds like she is alert and oriented. And looking at her, do I see any major bleeding?
Nope. You see a little small laceration on her chin that's oozing, that's all.
Okay, alright, and she's talking to me, so her airway sounds patent and clear. I don't see anything when she's talking to me with her airway.
Yep.
With her mouth, okay. And how is her breathing?
Breathing is 32 and late, clear.
32?
Yep.
Okay, alright, and I'm gonna fill her radial pulses.
You notice that the left arm has a second-degree burn all the way to the shoulder, but they're strong and regular.
Okay, alright, and what is her skin?
Pink, warm, and dry everywhere else.
Okay, pink, warm, and dry. Alright, and okay, Betty, so we are going to start getting you transported to a hospital, and just looking at her, you said there's burns on her left arm. Is that the only noticeable burns?
Yes.
Okay. Alright, so we're gonna start transporting you, and there's not look like there's burns to her face at all.
No burns to the face.
Okay. Alright, and so I have vital signs set up. I'm gonna get an IV started as well. I am going to, I don't expect that she needs oxygen at the moment. She doesn't seem like she is shocky, and her sats are pretty good, but we are gonna get an IV started, okay? And start transporting. And while we're transporting, I'm gonna do a full assessment on you, okay, Betty?
Okay.
Okay, so, I'm gonna feel her head for deformities, her face, her
You just have
eyebrows.
that laceration of the chin is all.
Okay, so no leakage, anything like that, and pupils.
Equal active in range.
Okay, alright, so I'm gonna have somebody, Kay, if you would, just apply some pressure to that oozing chin to see if that, direct pressure will help the bleeding there. Looking for JVD, yep, on the chin there.
All good.
Looking at the neck, yep, gonna feel the ribs, the sternum, all four quadrants
baby
of the
cake.
abdomen.
Oh shit.
Baby
Oh
cake.
crap, are you pregnant?
Yeah, I'm 30 weeks pregnant.
30 weeks pregnant, okay.
She carries it well.
She does, yes.
Okay, so, abdomen is pretty protruding just from that.
Yes, she's got a little soccer ball, but it is firm.
Okay, alright, and I'm gonna fill both arms, radial pulses, I'm sure it does, Betty. We're gonna get you, get that wrapped up, okay? Get your burn wrapped up with
Okay,
a
burn's
dry,
wrapped.
sterile dressing.
Or draft.
Okay, awesome. And I'm gonna feel her pelvis, both legs,
You see right ankle deformity?
right ankle deformity.
Yep.
Okay, well, if somebody can split that for me,
Okay.
you got that, Connor?
Yep, we'll do that if you'll hand me a sandwich flint and
Just verbally, just
Verbalize.
verbalize.
verbalize splinting, CMS before and after splinting.
Okay, and so with the burn, I am gonna start a 500 milliliter bolus on her, as well.
Okay, running that 500 now.
Okay, so can you tell me, Betty, are you allergic to any medications?
No,
Okay, and do you take any medications?
iron supplements.
Just iron? Okay, and do you have any chronic illnesses, medical history that's relevant?
No, just 2 pregnancies, 1 live birth.
One live birth, okay, perfect. And, what is the last time that you ate?
2 hours ago.
2 hours ago?
Try it again.
Okay, and you said that you were just driving, someone came in front of you and you hit them, correct?
Yep.
Okay, alright, and so how, are you having like any serious pain right now?
My arm really, really hurts.
Your arm where it's burnt on the left
Yes.
side here? Okay, alright, well, I'm gonna get you some pain medication, okay?
Okay.
Alright, so I'm going to give you, 50 mics of fentanyl.
Okay.
And that should hopefully take the edge off of your pain a little bit there. So vitals are looking good, the heart rate is a little bit fast, blood pressure is definitely not bad at all. Entitled 39, so that's at 94. Okay,
Okay, 50 mics of fentanyl and 1 ml.
okay. Not having pain anywhere other than your arm?
My ankle kind of hurts, but my arm really hurts.
Nothing crazy, okay. And, does everything feel okay with your pregnancy, or does anything feel different than normal?
No, everything feels fine.
Okay, alright, that's great, and you said you're about 30 weeks pregnant?
Yep.
Okay. Alright, so I'm gonna call the hospital and let them know that I have this female patient. And, so she was in a motor vehicle collision, other passenger did pass away and there was a fire, but she was taken out of the car, with burns on the left arm. Looks like we have about 5 total body surface area burn. We do have a deformity to the right ankle that we have splinted, and we have treated her with 500 milliliter bolus and 50 mics of fentanyl. And patient is, last vital signs are as shows.
Okay.
Do you have any questions for me?
Nope.
Okay, we'll be there in about 10 minutes.
So with pregnancy, do you have to worry about the dosages for narcotics and stuff? I'm trying to remember
We'll
whether.
talk about that.
Okay.
But finish your, anything else you want to do for this patient?
Let's see. So we've got her laid down. We'll keep her warm because of the burn, so we can cover her up. But other than that, no.
Okay. Cool, clean it up.
That's really good, Frankie. I was like very scared.
It was really good, actually.
No, like I was like writing it down to like test myself, and then I started checking it off. You freaking hit everything,
Oh, good.
and I feel like it was like fluid. Sorry, Curtis.
No, no.
Your feedback's more important, but I just had to tell you that like it was so smooth.
No,
Thanks
I
for, like,
actually
pumping
would
me up.
rather